How is angioplasty performed? The entire procedure takes 30 minutes to a couple of hours. The patient will remain awake throughout the procedure and is free to ask any questions. Any unusual sensations must be reported to the doctor. A local anesthetic will be injected into the groin area. A small incision is made and a small tube called a sheath will be inserted into the femoral or radial artery. A guide wire is then inserted into the sheath. Aided by X-ray images on the monitor, the doctor threads a catheter over the guide wire into the heart and coronary arteries. A dye is then injected through the catheter to visualize heart and coronary arteries. Once an obstruction is detected, a guide wire is inserted through obstructed area. A balloon catheter is threaded over the guide wire into the obstruction. Once the balloon is positioned in the narrowing of the artery, it is inflated and deflated several times in order to press the plaque back against the wall of the artery. When the doctor is satisfied that the artery has opened, the balloon is removed. This procedure is generally successful and has a low rate of complications. Once the artery is widened, a device called a stent is usually placed in the artery to act as a support. The stent helps to prevent the artery from narrowing again after the angioplasty. It is placed on a balloon catheter and guided to the blockage. When the balloon inflates, the spring-like stent expands and remains in the artery permanently to hold it open and improve blood flow to the heart. A new advancement in angioplasty is the drug-coated stents, also called drug-eluting stents. These stents are coated with a drug which prevents reblocking of coronary arteries. The drug-coated stents have been widely studied in a number of patients internationally. World over, more and more angioplasties are done using these latest drug-coated stents. Once the stents are in place, the balloon catheter is removed and angiograms are taken to evaluate blood flow through newly widened artery. Finally, the guide catheter is removed and procedure is completed. After the angioplasty, cardiologist will take a decision regarding whether or not artery is sufficiently opened. The patient will be taken to coronary or special care unit where he will be monitored for approximately 24 hours. Blood pressure, heart rate, pulse rate, etc. will be checked and routine tests will be done. When the sheath in the groin is removed, firm pressure will be applied to puncture spot by hand or clamp for 20 to 30 minutes until the bleeding stops. A pressure bandage or sandbag will cover the groin area for several hours. The patient is asked not to bend the knee or the hip out the side as it may cause bleeding from the puncture spot. During coughing or sneezing, it is required to press firmly on the bandage with fingers. In case of pain or discomforts, notify the nurse or doctor immediately. The patient can usually go home 1 or 2 days after the PTCA, unless some other treatment is required.